Well, a very good morning to everyone. Thank you so much for logging on to our kickoff webinar for the Caribbean Regional Coalition for the Decriminalization of Suicide. My name is David Johnson. I will be your Master of Ceremonies today. I do want to invite you from the start to be as active as you can in the chat. You can let us know where you're joining from. You can let us know your role. And if, of course, you want to plug your email, any other contact information, we'd love to reach out and connect with you after this webinar. We have quite an agenda this morning, and we are going to start with the official welcome. I'll do that for you. And I just want to share a bit on the background behind the coalition that is being launched today. We would have held back in May, and Desiree, you can move on to the next slide for me. Back in April, May, we would have launched with our workshop. And this workshop featured several partners from the region, as well as from the international level. We've had a lot of support there. And we really thought that this would be a great opportunity for us to set the context, but to also generate that level of advocacy and that level of capacity. So on the next slide. Yeah. Just in terms of the background, in terms of why are we doing this? And we know that at the global level, suicide is still illegal in 23 countries. And 4 of those countries are within our region. St. Lucia, Grenada, the Bahamas, Trinidad and Tobago are on that list. And we know that criminalizing suicide, of course, increases the stigma around mental health, and it makes it a lot more difficult for persons to seek help in their time of need. And so we think as a coalition, it's important that we come together to try to tackle this issue and to treat to suicide decriminalization as that springboard, which we can use to advance action around suicide prevention, around mental health awareness, but to also make sure that we can create that healthier region that's a bit more sustainable for future generations. And so our objective is really to build on the efforts that were launched in Guyana. And we want that this cascades across the entire Caribbean region. And that's what this regional coalition is all about. On this next slide, let's talk about what exactly are the outcomes that we had coming out of that workshop. And there were 3 core outcomes. Number 1 was that, of course, we formed this regional coalition. The structure is in place. We've also developed a regional advocacy strategy. And this strategy, of course, will inform our activities on a regional level. But also, we are going to narrow this down and funnel it down into national activities and national advocacy strategy. And then, of course, there was also this key opportunity to hear from experts at the global level, persons who've done the work across the globe, and to learn from their own experience. And so definitely in terms of resource mobilization and the sharing of that collective knowledge, it was also a great opportunity to hear from some of our global partners. And so with this in mind, what exactly is our vision and our scope, and what are we going to be doing as a regional coalition? On this next slide, we show you exactly that. The idea that, we're aiming to build on that progress, like I mentioned in Guyana, but also we're going to commit to 3 key overarching objectives, which is number 1, to advocate for the repeal of suicide and suicidal behavior as a crime. We also want that suicide is recognized on a regional level as a public health concern, not a crime. And then finally, we want to be able to work with our government and civil society partners to implement evidence-based suicide prevention strategies at the national and regional level. And so as we go through today's launch webinar, as an audience, we hope that you'll reflect on what ways can you partner with us as a coalition to advance this work. We want you to take careful note of all that is mentioned and to explore those avenues that you can bring in your own capacity in whatever field and whatever sector you're coming from to help us to move forward this work. And so that's it in terms of the official welcome and the official introduction. I really want to say thank you to everyone who's been a part of this journey so far. And I really invite you to hold our hands as we embark on this journey to save lives and to build hope across the Caribbean and indeed across the world. And so at this moment, I'm pleased to invite Dr. Guy Fons, who's a medical doctor from Chile, who has been associated with the World Health Organization for a decade now. And he leads the work on the global coordination mechanism on non-communicable diseases at the World Health Organization headquarters. And he is, of course, the cross-cutting strategy lead for the NCD department at the WHO. Dr. Fons, over to you, and thank you so much for being here.
David, thanks so much for the intro, kind intro, and really delighted to join you on this discussion. It hasn't been easy, and I appreciate the flexibility of you and your team. I really did not want to miss this opportunity to present a few words, say a few words, join you in this important discussion. And thanks you to those organizing. Thanks to the great collaborations across many of those organizing and WHO. We've had an amazing long-term engagement with United for Global Mental Health, with NCD Alliance, with Mindwise, and a nod to Maria from Mindwise, who has made this happen and has had that flexibility. In the video we were listening to, David, and others, there was a call for the stakeholders to participate. WHO is and will continue and is very has prioritized its agenda now for a long-standing path, and we will continue to do so. We will continue supporting communities, supporting organizations, supporting countries to break through this devastating reality. So thanks for the opportunity to speak. It's such an important discussion, such an important coalition that you have launched. Congratulations to all. A strong coalition for advocacy, but also for action. And such a very important milestone for the Caribbean region. Really impressive. And the video already highlighted many of the messages coming out of that workshop. And David, you presented some very nice messages already. I may come back to some of those data and evidence, because you all Caribbean Regional Coalition members, I'm sure, are very aware of the data, of the urgency, of the gaps. But we must go back to to that evidence, to those numbers, to trigger, to catalyze action. And as you've been saying in the video and the presentations, 1 in every 100 deaths globally is by suicide. Each year, more than 700,000 people take their own life. And suicide is currently the 4th leading cause of death in 15 to 29 years old. And we heard that in the video also. So this data is alarming, and it should drive action. And importantly, because some populations particularly affected, for instance, indigenous peoples, members of LGBTIQ+ communities, persons who are incarcerated or in jail, refugees, migrants, are most underserved, marginalized, and do not have access to those life-saving interventions. And not only is this loss of life tragic in itself, but it also has profound and devastating effect on families, communities, individuals. Suicide is not a mental health condition, but some people with mental health conditions will be at greater risk of suicide, and we need to bridge that with the sensitivity and the contextual evidence. Reducing the global suicide mortality rate by 1/3 by 2030 is a target of both UN Sustainable Development Goals and the WHO Global Mental Health Action Plan. And this was also, because of this priority, because of the urgency, because of the data, this was also discussed at the recent SIDS relevant meetings in Barbados, and made its way very clearly into the outcome of those meetings, and the global commitments laid out in the 2023 Bridgetown Declaration on NCDs and mental health. That momentum, that power, that impact, that advocacy, that movement should make its way also into the upcoming 4th high-level meeting on NCDs happening next year, September, in New York. We need to see clear actions, not only challenges, we need to identify success stories across many of the countries that you've already highlighted, and how we can move forward. And those recommendations, those how-to, those interventions that will make a difference need to make their way into that final document in the 4th high-level meeting on NCDs and mental health in September. Given all of this urgency, data, evidence, advocacy, movement, coalitions, major human rights-based challenges do persist to meeting this goal. And that is very evident in at least 23 countries worldwide. You've mentioned this already in some specific countries. At least 23 countries worldwide have challenges and are criminalized for suicide and suicide attempts. So ultimately, decriminalizing suicide and suicide attempt represents critical steps governments must take in their efforts to prevent the overall prevalence of suicide. And again, this must make its way to that fourth high-level meeting. WHO has been participating and being very active in leading the discussion and the evidence generation and the research. There's a very important WHO resource, which is the WHO policy brief on the health aspects of decriminalization of suicide and suicide attempts, which cites data and research to make a very strong case for decriminalizing suicide globally. It also includes case examples from countries that have recently decriminalized suicide and suicide attempts. You mentioned Guyana in many of your comments already, but also Pakistan, Singapore, across the globe. There are good examples, and we need to build on that to understand how can we have successful interventions, and how can we move the needle forward. And this guidance, WHO policy brief, provides important insights to policymakers, legislators, parliamentarians, communities, affected individuals, and other decision makers. And I stress that because communities, affected individuals, coalitions like yours are decision makers. You need to understand your expertise, your guidance, your insights, and your on-the-ground contextual understanding of the challenges as extremely important for decision-making processes. The criminalization of suicide perpetuates an environment that fosters blame and stigmatization toward people who attempt suicide, and at the same time fails to recognize the role of social, economic, and cultural factors that play a role in suicide and suicide attempts. Criminalization deters people from seeking timely assistance and accessing interventions due to the fear of legal and repercussions and stigma. And you've mentioned that, and WHO is very strong behind that, the concept of unpackaging the challenges for it. And why decriminalize suicide? There are many arguments, and you have a long list of whys and solutions to those whys. But I would highlight a few very important ones. Decriminalizing suicide will save lives and alleviate the stress and harm faced by persons concerned and their families. It will reduce stigma and shame associated with suicide and mental health conditions and creates possibilities for increased understanding around emotional distress. It leads to increased collection of accurate data on suicide and suicide attempts, extremely important from a WHO perspective, which will help inform appropriate, evidence-based, contextual, adequate interventions on the ground. It enhances opportunities for awareness raising and advocacy around suicide prevention. And ultimately, all of this, all importantly, decriminalization of suicide puts the well-being of individuals, families, and communities first. And a critical catalyst for action is the voice of mental health leaders and advocates working on the ground. Your voice and expertise is extremely important. Your voice and your expertise will influence policymaking processes and will make a difference. So the powerful stories you will present and you have been presenting from those affected will catalyze that much needed action. The movement from communities, individuals affected is the breakthrough for enhanced equity and contextual solutions and sustained solutions on the ground. So again, from WHO, such an important discussion. Congratulations for this launch and look forward to a very productive discussion, and WHO will be supporting the path forward. Thank you so much.
Thank you so much, Dr. Phones, for joining us, and we're so pleased to have the support of WHO. We hear your words in terms of, catalyzing this action, and the important bit at the end there about putting the well-being of people and their families first. This is something that we'll keep at the core. Thank you so much for your kind words. Now we'll have our official remarks by Nika Saidi. She leads the UNDP's work on mental health and psychosocial support and engagement with faith-based organizations and religious actors. Over to you, Nika. Right, I think Nika might have dropped off the call. So I'll welcome instead Dr. Margaret Nakid Chatoor. Dr. Chator is a founding member of our coalition, and she's an assistant professor at the University of Trinidad and Tobago and was the president of the Trinidad and Tobago Association of Psychologists. Dr. Margaret also sits as the co-chair of the International Association for Suicide Prevention and PAHO's Conference 2024. Over to you, Dr. Chator.
All right. Good morning, good evening, good night to all of persons wherever you are. Glad to be here. It is indeed a pleasure to be here as we create a moment in history. In my introduction, I would look at the context regarding the decolonization of laws and also why decriminalization is important for decreasing suicide rates and for suicide prevention in the Caribbean. So the decolonization of laws against suicide in the Caribbean refers to the process of revising or abolishing colonial era laws that sought to criminalize suicide and suicide attempts. Inherited from European colonial powers, these laws reflect outdated views that treat suicide as a criminal act rather than as a mental health issue. In past years in the Caribbean, there have been arrests for attempted suicides recorded, and legal opinion still suggests that there is support for this 19th century archaic law, as those who support penalizing suicide argue that legal punishments can deter suicidal acts, can serve as a social condemnation of unacceptable behaviors, and can ensure that justice is done. We know now that all of this is not true. However, decolonizing laws against suicide in the Caribbean faces several challenges. One, the historical and cultural stigma, which can make it difficult to shift public perception and gain support for any decriminalization effort. Two, the legal and institutional resistance due to the entrenched colonial legacies where reforming these systems would require significant political will and legal expertise. Three, the lack of mental health resources. Four, the economic constraints where implementing new mental health policies and services can be costly against limited budgets and competing priorities, especially in countries that do not consider mental health to be a priority. Five, public awareness and education about mental health issues and the benefits of decriminalizing suicide. And six, cultural sensitivity, as any reform must be culturally sensitive and relevant to the unique social and historical context of our Caribbean societies. As you would realize, decolonization of laws shifts the narrative. It shifts it to a modern understanding of mental health, which emphasizes that suicide is often linked to mental illnesses, such as depression and complicated grief. Decolonizing these laws, therefore, involves shifting from a punitive approach to one that focuses on mental health care and support. So why this regional initiative? Why is decriminalization so important now in our history? In May 2020, the International Association for Suicide Prevention issued its policy recommended that attempted suicide be decriminalized, as this advocacy can reduce social stigma, help to remove barriers to adequate mental health care, increase access to emergency medical services, foster suicide prevention activities, and improve the well-being of those most vulnerable to suicidal behaviors. We note recent decriminalization efforts in Guyana, in Pakistan, in Singapore, in India, and in Ghana. These countries have recognized the importance of providing support and treatment for individuals experiencing suicidal thoughts and behaviors, rather than in penalizing them. It is important to note here also that any move towards decriminalization is often accompanied by efforts to improve mental health services, and increase public awareness about mental health issues. In conclusion, under the auspices and guidance of United for Global Mental Health, the International Association for Suicide Prevention, Lifeline International, the World Health Organization, and other international bodies, we welcome the formation of the Regional Coalition for the Decriminalization of Suicide in Trinidad and Tobago, the Bahamas, in Grenada, and in St. Lucia. This coalition represents a diverse array of stakeholders, including civil society, persons with lived experience, health professionals, policymakers, and NGOs committed to driving change at both the local and the regional levels. We wish the Regional Coalition all the best as they raise awareness and educate, engage with media professionals, work with policymakers and legislators to reform existing laws, and as they advocate for community-based mental health services that prioritize human rights and quality care. Thank you. I hope, David, I stayed within my 4 minutes. Thank you.
You did a wonderful job, Dr. Margaret. Thank you so much for those kind words, and we look forward to your active participation in this coalition. Thank you so much.
Most welcome.
Continue with the official remarks. I now turn to Mr. Bertrand Moses, who has submitted a video. He's actually on the ground right now in Grenada, assisting with the MHPSS efforts there. Bertrand is the MHPSS specialist, child protection officer at UNICEF for the Eastern Caribbean area, who oversees that effort within 12 Caribbean countries and territories. And today he speaks on UNICEF's partnership and collaboration with the coalition.
Regional partners, please allow me to thank you for being here. And to United for Global Health, I thank you. And to our regional coalition partners, I also say thank you for attending this critical Caribbean Regional Coalition for the Decriminalization of Suicide kickoff meeting. In our last meeting earlier this year, it became abundantly clear that this is a priority for us. In fact, as I sit here in Grenada, responding to Hurricane Beryl and its disastrous impact, it is quite clear that we must prioritize the mental health of persons who are at their lowest. Indeed, there are countless stories underground here of persons feeling that all hope is lost. There are stories of trauma, grief, and loss. With increasing climate change issues, with increasing natural disaster issues, we must move forward to decriminalize suicide and, in turn, prioritize mental health response systems. Indeed, this coalition has the power to develop a regional referral and response plan when persons feel like giving up in the face of increasing disasters. This indeed is a priority action point from the World Health Organization's policy brief titled Health Aspects of the Decriminalization of Suicide and Suicide Attempts. Undoubtedly, UNICEF remains committed to this effort. In our State of the World Child's Report in 2021, titled On My Mind, promoting, protecting, and really safeguarding and caring for children's mental health, we highlighted that over 46,000 young people globally are affected yearly by suicide. And suicide is among the top 5 causes of death for children and young people. UNICEF remains committed to ensure that suicide decriminalization is a priority. And as I close, please allow me to utilize the 3 Ps of the United Nations Convention on the Rights of the Child to illustrate our joint commitment with our powerful coalition present today. The first P is that of participation. We remain committed to working with organizations such as coalition member Let's Unpack It to include the voices of children and young people in issues that affect them. We have started this by producing www.youngcaribbeanminds.com, which is a mental health hub that contains referral service directories when young people are at their lowest, and mental health workbooks when young people are isolated and need to work on something together. This allows us to see the demand and the search results around suicide so that we can advocate even stronger. The second P is that of provision. Over the past year, we have been working with our academia partner, the University of the West Indies, and the Ministry of Health in Trinidad and Tobago to develop You Matter within the Eastern Caribbean, a mental health text line that will allow young people to reach out directly to someone in the safety of chat, a secure system. This will also allow us to collect anonymous data to further advocate for the decriminalization through data points that say there is indeed a cry and a need. And the last P, finally, protection. We are working with Caribbean partners to establish referral and protocol systems that would allow us to ensure that when suicide-related challenges arise, we have a pure, clear, and straightforward protocol to ensure that young people's needs are being addressed in the most efficient way. In closing, we at UNICEF continue to be committed to the coalition and committed to working with our coalition partners relentlessly. Together, we can ensure that the decriminalization of suicide is a key priority, and we thank you for participating with us.
Thank you so much, Mr. Moses. Indeed, we're very happy to have the support of UNICEF ECHA within this coalition, and we look forward to partnering with you moving forward. To offer official remarks next, we have Professor Taiwo Sheikh, who joined us at our workshop. Professor Sheikh is a professor of psychiatry and is a member of the African Union High-Level Advisory Committee to Africa's CDC on NCDs. He's also convener of Nigeria Suicide Prevention Working Group for Suicide Prevention and Decriminalizing Suicide in Nigeria, and also sits as the Africa Continental Representative for Lifeline International. Professor Taiwo?
Thank you very much. I have a few slides. I don't know if someone could share it or I should share it. Let me thank United for Global Mental Health and the Caribbean Forum for inviting me on behalf of Lifeline International to give an opening remark here. Can the slide be shared or I should just keep on talking?
Can I get your slides and I can share them?
I've sent it to you. Check your mailbox.
Okay, I'll do that.
So why are we here? We are here talking about suicide decriminalization worldwide. And I can assure you that Lifeline International has taken a very bold step in a global campaign towards decriminalization of suicide. There was an open impact campaign which was launched in October 2023 in London. And that was at that launch, a campaign brief was also launched. And presently, our latest research in the campaign brief that we have, it shows us that about 1.2 billion people live out of reach of impactful suicide prevention resources, and with entrenched stigma all over the world. There are about 25 countries where suicide remains a crime, and approximately 850 people are really exposed to this in these 25 countries. And 27 other countries, the legal status of suicide is not very clear. And at the same time, they also do not have access. So when we look at it, we find that about 1.2 billion people globally are out of reach of impactful suicide prevention. And then when you further look at it critically, you realize that most of these countries, 11 of the 25 countries where suicide remains a crime, are in Nigeria, and the other few countries remaining are mainly in the Caribbean. And we have one thing in common. We derive our independence from the Great Britain. And our colonial masters left these laws with us, and they have actually gone back to change the laws in their countries. Next slide, please. So we in Africa, what are we doing? We leverage on the strategic plan of Africa CDC. One of the key objectives of the strategic plan for Africa CDC is advocacy for decriminalization or for removal of barriers that will prevent help seeking for suicide on the continent of Africa. I don't need to go into the data of suicide as relates to Africa. Other speakers have spoken about this, but I can assure you that suicide remains the second most leading cause of death among young people between 15 and 29 years old in Africa today, only second to road traffic accidents. And the African continent has the highest male suicide rate in the world today. So by the time you add these two together, you can understand where we are heading to in Africa if something is not done. Next slide, please. And this is what I call the photo of Africa. After our alignment with Africa CDC, we were at the International Conference for Public Health in Africa. And here you can see the Minister for Health in Sudan, representative or Minister of Health in Zambia, and other very strong participants from the African continent, where we launch a campaign for reducing suicide trend in Africa and also the criminalization of suicide attempt in Africa. Next slide, please. So after that launch, we actually picked, sorry, I think you've moved too fast for me. Yes, that is okay. After that, some background talk. Okay, after the launch, we identified 3 countries. Lifeline International is actually working with 3 countries campaigning for decriminalization of suicide on the continent. And these 3 countries, we have Kenya, Nigeria, and Malawi. But we are also supporting other countries in the use of, in our own use of technology and use of our professional ethics and so on and so forth. But these 3 countries are the ones that Lifeline is actually working with towards decriminalization of suicide on the continent. In Nigeria, which is in the middle there, we have convened a group, Nigeria Suicide Advocacy, Suicide Prevention Advocacy Working Group. And as I'm talking to you now, we have, we have a committee that is developing a draft bill for suicide prevention in Nigeria, which includes decriminalization of suicide. And we are hoping to launch that bill in the next few weeks and present it to the National Assembly for passage and signed by the president of the country. So this is what we are doing. And the 2 other countries in Africa also have strategic committees for suicide prevention, and they are also working on a bill to prevent, to decriminalize suicide on the continent. Next slide, please. So what are the key messages that we deliver in Africa regarding suicide, decriminalization of suicide? The first message is that the law is a colonial law, and I've had my colleague from the Caribbean talking about this. And those who brought this law have changed it in their own countries and even reviewed it several times after that. Another key message is that the law attempts to stop the act, but it does not stop the thoughts. And we know that the act comes from the thoughts, and the law does not also address the social determinants of suicide. We know that the law does not recognize that suicide is a preventable condition. And this is something that is very important that we advocate for people to understand that suicide is preventable anywhere, everywhere, and at any time. And it's a barrier to help seeking and support, because if the law is applied on you, you go to jail for a minimum of 1 year, in some countries even much more than that. And if you are found to be rendering support without declaring to the police, you can also go to jail for a month. So there is a barrier to help seeking and support. And then finally, this also constitutes a barrier to data generation, because a lot of people who die because of suicide are not reported as death as a result of suicide. So many of them are reported as accidents or some other conditions. So we really don't have data. We don't have data for planning. We don't have data for resource allocation. So it's very important, like other speakers have said, that we decriminalize suicide attempts, we decriminalize suicide globally and especially within the continent of Africa. We have so many similarities between Africa and Caribbean, and it's very important that we address this. Next slide, please. So I want to thank you very much for giving us this opportunity to give this opening remark on behalf of Lifeline International and on behalf of Africa CDC. Thank you very much.
Thank you so much, Professor Taiwo. Indeed, thank you so much for sharing those insights. And there are a number of, I believe, similarities between our regions. And so we're definitely looking forward to your continued partnership and helping as we build out this coalition. Thank you. At this time, I turn over to Gamini Manuera, who also joined us in presenting at the workshop. Gamini works for the UNEP Chemicals and Health Branch as a program management officer and is a chemical risk management specialist. He currently works as a consultant at the Center for Pesticide Suicide Prevention in Edinburgh. Gamini?
Thank you very much. And good morning to everyone. And from my side also, let me thank everyone, the organizers, for inviting me for this very important meeting today, launching the coalition. I think it is very important, and I'll let you know why I'm saying important in a minute. So if I have few slides myself also, if if you could kindly move to the next one. Yeah, I mean, this is the, yeah, we can go to the next one. I'm trying to sort of go through very quickly, as only 2 slides I have. As mentioned, you know, I'm currently working as a consultant for Center for Suicide Prevention, Pesticide Suicide Prevention. And what the center is focusing is on the countries where pesticide suicides is recognized as a problem, and we approach the countries and we help the countries to conduct some research needed for identify pesticides responsible for this, and support the pesticide regulators in the country to generate data and make informed decisions on regulatory actions, so then we can take remove the access to these lethal means, and also we support the countries to follow up with after taking these control actions, what are the implications on crop production or in agriculture, as well as on suicide in general. Next slide, please. So this one, of course, I'm trying to focus on very briefly what CPSP is doing in the Caribbean region. As mentioned before, we facilitate informed decision-making to limit access to highly hazardous pesticides. And in that process, so we focus on identification of highly hazardous pesticides based on the criteria that was established by the WHO and FAO, and then help countries to access poisoning incidents with emphasis on pesticide poisoning, pesticide suicides. It is very important, as mentioned by the previous speaker, the data is critically important for decision making. That's where the challenge we all have everywhere. So what we are trying at the CPSP is to sort of work with the countries to generate factual data representing the current national status with vital information needed for policy review. It is again underlined here, vital information, because it's sometimes in some countries they may identify that this was caused by a pesticide just generally, but it is not enough. We need to know what pesticide, because if you if you take a country, there are over 200 pesticides. So we really want to know which pesticides cause the problem. And then we identify and promote safer alternatives to the pesticide, as well as strengthen intersectoral collaboration and post-registration surveillance. This point is very important again, moving forward with this coalition, because as we all know in general, in most of the developing countries, the pesticide regulatory sections and the health sector and other sectors that are critically important to collaborate are not functioning really well. So I think this coalition can play an important role connecting these dots between these different agencies and institutes so that they can sort of work together, harmonize collection of data, as well as sharing the data between different agencies so that they can make informed decisions. So this is something that actually we are currently working. We work with PAHO and we work with FAO, but still, we need people again at the country level working so that they can sort of actually make some contribution for this intersectoral collaboration, as well as collecting the factual data, as I mentioned before. The countries we are focusing right now, not limited to these, but we are mainly working on Suriname, Guyana, Trinidad, Tobago, and Barbados. So we are actually open to work with any country where there is a need. What we are actually doing is to sort of go to the countries, sit with the agencies, and trying to make these actions a reality. So I stop this very brief introduction. Congratulations again for this coalition, and it is a very important initiative, especially from the CPSP side. Also, this is a very good welcome news because we need partners who can help us to connect these different agencies and generate factual data. So looking forward to working with all of you, and thank you so much for inviting me once again, and good luck, all the best for the coalition. That's all.
Thank you so much, Gamini, especially for driving home the point on data and reporting, as well as intersectoral collaboration. We do indeed look forward to continue to work with you and gain your insights moving forward. Thanks, Gamini. To close off our official remarks section, I'm pleased now to introduce Maria O'Brien, who is the director and co-founder of Mindwise TT. She's also the focal point for Voices of SIDS, and of course sits as a co-chair of our coalition. Maria, over to you.
Thank you so much, David, Dr. David Johnson. So proud to be working alongside all of our partners here today. I want to recognize my suicide prevention team lead, Rasida Ramkalawan, who could not be here due to a personal matter, but she has really been our champion with this coalition so far, and I wanted to recognize her today. All protocols observed. Good morning, partners, peers, volunteers, advocates, fellow survivors, fellow small island developing states, fellow humans. In the work I do now, I am the champion of the power of lived experience to shape our public health strategy and service provision, the role our stories play in how we see ourselves and how we see what we can become. It is my lived experience of suicide that brings me here today. My story started with Michael, a young man and close friend in Baltimore, Maryland, at the age of 35, whose body I discovered in 2011 on the early morning of our National Republic Day in Trinidad and Tobago, back home. Every Republic Day, ironically, days close to the International Suicide Prevention Day, my body remembers, my heart remembers. That journey started then, led me to many life-altering discoveries. The first of which was that every 40 seconds, we lose someone to suicide. That it was very common for men Michael's age to be lost to suicide. Then I discovered that many people in my own life had lost people to suicide or survived their own suicide attempt. And these secrets only came out when I had a story of my own. I heard a story from a male mentor about a bunkmate in the army who he woke up to find, about husbands who had overdosed, about children and friends and parents, survivors all. So many stories buried and hidden. Like many other survivors of another suicide, I soon discovered my own suicidal ideation. And with that, many online communities for survivors for who were struggling with pain. I rediscovered this ideation as a cancer patient struggling through diagnosis and treatment. A personal trauma that reminded me of another lesson, a very important one, that suicide takes place when pain exceeds resources for coping with pain. And pain is something some of us, if not all of us in this room right now, are managing on a daily, if not hourly basis. Now, I'm a mental health advocate. I have training, I have resources, I have knowledge that can help me in a crisis. And even with all of that, I found myself managing my own stigma, my own challenge in finding support and asking for help. The power of stigma when it comes to suicide, when it comes to hopelessness that is often labeled as weakness, can be seen everywhere, even in how we run our suicide prevention ads, in how we talk about suicide, as if the very word scares us. However, thanks to our partners in this room and many here at home, I also learned in the past few years about the fact that suicide was a crime in my own country and 23 others. We tell people in our advocacy to reach out, to share their feelings, that there are people who care and want to help. And this is true. But how can they talk about their suicidal crisis or attempts, even when sharing that information means admitting to a punishable crime? Fundamentally, these laws hijack the service seeking that can be found in our public and private mental health care and support system. No matter how much our friends and partners, some of whom are in this room, are working tirelessly to improve service provision and the ecosystem, tackling really large systemic and cultural issues, this problem is a barrier that we need to remove. We can right this wrong. This is a story we have been telling our peoples that we can change. This fight of making attempted suicide not a crime is one we can win, as we face so many continuous battles for the mental health and healing of our communities here in the Caribbean. Let us send a message loud and clear that we plan on leaving no one behind and that suicide is not a crime. Thank you for being here. Thank you for supporting or joining this coalition. I'm sure I join our fellow partners in saying, let's get to work. Thank you, everyone.
Thank you so much, Maria, for that passionate call to action and that reminder of that lived experience bit, and the importance of realizing that there are people at the core of this action. So thank you so much, Maria. Now I'm very pleased to hand over to fellow co-chair Desiree Nicholas, who sits as the president and founder of Carriacou Wellness Alliance and who has worked very hard to pull this launch, as well as a number of other activities for the coalition together. Over to you, Desiree.
Thank you, David. So again, my name is Desiree Nicholas. I'm a licensed clinical social worker, and I'm the founder and president of Carriacou Wellness Alliance. And today I'm serving as the co-chair for this coalition, along with Dr. David Johnson. In presenting our advocacy strategy, it's something that we have been working on as a coalition for some time. And I'm going to share. So we're focused on three main areas: mobilizing and sensitizing regional stakeholders, our national advocacy efforts, as well as our global and regional advocacy efforts. Let's break those down. We're really focused on building capacity for stakeholders in the region. And we're doing this through workshops, meetings, really trying to raise awareness and also ensure that everyone is trained on suicidality and suicide prevention, as well as trained on advocacy. One of the things we've found in working on this strategy is that it's important that people are sensitized on suicidality in general, because we're bringing together people who are not just mental health professionals. We are bringing in people who have lived experience, as well as bureaucrats, politicians, people from different types of organizations, different stakeholders, from religious bodies. And so it's important that we are all on the same page when it comes to what suicidality is, and we're ensuring that we're offering support as a coalition on these efforts. At the national level, we're ensuring that our strategy is country specific. That's because the issues that are going on in each country as it relates to suicidality can be different. While in some countries, pesticides may be a main method that's being used, in other countries, it may be different. So we're ensuring that our strategy is data-driven when it comes to the interventions that are being used, and ensuring that suicide prevention is at the helm of what we're doing. It's really important that we are bridging the gap between stakeholders and policymakers. And that is part of what we're doing here today. And so if you're a stakeholder who is not yet part of this coalition, this is your call to action to really join us, right? Because we really want to ensure that on the national level, we're assisting everyone in drafting legislation, whether that is to reform laws or create laws that can address the way suicidality is handled in each country. At the global and regional level, we're really focused on influencing key policy declarations by leveraging the national, regional, and global events that are happening. And these are a few of them. The Commonwealth Heads of Government meeting, the IASP Pan American Conference happening in November coming up, World Suicide Prevention Day, the World Health Assembly, UN high-level meeting on NCDs and mental health, the Commonwealth Health Ministers meeting, as well as CARICOM Heads of Government meeting. We're so grateful to have so many partners on this coalition. And this is a moment to really highlight some of you. So we have Let's Unpack It at the regional level, Mindwise, CARICOM Wellness Alliance, BSG Psychological Services, St. Lucia Crisis Center Corporation, Psychological Testing, MNC Psychological Testing and Counseling Center. And at the international level, we have United for Global Mental Health and Global Mental Health Action Network, which has been a big push for why this coalition is happening. The International Association for Suicide Prevention, Lifeline International. We're thanking you so much because you've provided so much knowledge so far to all of us who are a part of this coalition, and you've really done a good job of sensitizing us. As well, we have at the multilateral level, UNICEF, UNDP, and PAHO. And I think that's it for me. Thank you so much. We really ask that you join this coalition if you're here today and you're moved by anything that you heard. At the national level, we're starting to organize. So please join us, and also understand that we are very collaborative and we are open to feedback as it relates to our advocacy strategy. And so thank you so much for giving me the time.
Thanks so much, Desiree, for pulling this together, as well as presenting on the advocacy strategy. Definitely want to reiterate that call, Desiree, for everyone on the call to just reach out to us. We'll find a way to connect you. And in this next section, you're going to hear about a lot more ways that you can do just that. So it's my pleasure to turn over now to Chelsea Alan Jordan, who is the Vice President of Operations at Let's Unpack It. And she'll be chairing this next section where we present on our subcommittees and the work of our Secretariat. Chelsea?
Thank you so much, Dr. Johnson, and welcome to everyone yet again. Today marks a significant step forward in our collective journey toward compassion, understanding, and meaningful change in the realm of mental health. Our mission is not just to change laws, but to change lives, to create a society where those in crisis are met with support and not stigma. However, the scale of the work ahead is immense, as you would have heard just now and seen the list of activities that we have on the docket. So we need the partnership of advocates, technocrats, and leaders in the mental health space to drive this change forward. Today, we call on each of you to join us, to bring your expertise, your passion, and commitment to our cause. Today, we can create Together, we can create a comprehensive support system that reaches every corner of our community. So in this segment coming up, we'll introduce to you some of our dedicated coalition subcommittee members who will share the progress made so far and the next steps in our journey. Each speaker brings a wealth of knowledge and experience, and they will outline how you can get involved in their critical work. We also invite all audience members to consider joining these subcommittees or supporting the work in any capacity that you can. Your involvement is crucial in amplifying our impact and ensuring that no one faces mental challenges alone. So, to start us off, it is my pleasure to introduce Mr. Leon Cherry, who is a mental health coach at Carricote Wellness Alliance and a co-chair of the Caribbean Regional Coalition for the Decriminalization of Suicide, who will share on the Secretariat. Please join me in welcoming Mr. Leon Cherry.
Thank you, Chelsea. So like she said, my name is Leon Cherry. I'm a mental health coach at the Carricote Wellness Alliance, and I work as an assistant psychologist in St. Lucia. And what I wanted to do here briefly is just to explain our role as the Secretariat, which is to perform the administrative duties of the coalition. And what that has looked like so far is we have drafted the terms of service document, we drafted media invitations for this event, and also we engage with regional media houses to notify them of this event. And we will have a similar role in the coalition after the official launch today. And what that role will look like is we will chair coalition events, and also we will monitor and report on coalition activities. And what we'll do as the coalition expands is we will reach out to members and we'll notify them on various updates of different activities. Now, one thing I have to make clear is that the Secretariat does not dictate our advocacy strategy or policy. What it simply does is to ensure that members of the coalition actually follow this policy. And also, the Secretariat will be run by two co-chairs that will alternate every 2 months. So our two current co-chairs are David and Desiree, and then once their time is up, they will be replaced by other co-chairs. And finally, what I want to do is to just reiterate the same call to action as my other colleagues, and to say to join us in this responsibility, taking this critical role in ensuring that we reach our goal of decriminalizing suicide. And thank you. And now I will hand over to Chelsea.
Thank you, Mr. Cherry. Next, we welcome Ms. Emily Anna Bachin, who's at LU and UNICEF National Youth Mental Health Focal Point from Trinidad and Tobago, who will share about the Public Relations and Communications Subcommittee.
Hi, everyone. Good day, good day. I would say good morning, good evening, and good night for everybody who's tuning in all over. Thank you so much for tuning in today for this launch for decriminalizing suicide. That was such a crucial topic, as we have been saying at the beginning of this meeting. So I'm going to just share a little bit about the Public Relations Committee, which is a subcommittee, and what it would be entailing and what we are going to be responsible for. And I urge you and I encourage you to join the subcommittee, because it's going to be very impactful work that you're doing, and it's going to change lives, right? So the first thing is that we are going to develop and oversee implementation of the communications and influence strategy at the key global and regional aspects of it in the decriminalizing of suicide. Then the second thing we want to look at is developing and identifying the coalition. So we want to look at identifying like a symbol, a vision, a mission, and stuff like that, so that we can release it. And then after that, once we could, consolidate this, we could actually produce media so that we can send it out and send these templates and whatnot once we can confirm and verify this. And that's why we need people to come on board to be a part of the PR and communication subcommittee, so that you can be a part of the social media and, you know, launching newsletters and conferences and just being a part of all the work that there is to come, because there's a lot of work in store. And again, this would help with partnering with all the other organizations as well. And just a final note would be, we would like to distribute interview videos and partner with the public so that we can create visibility, so that we can make them more aware of what is decriminalized suicide and how it's going to change lives, like I said, and just create more awareness with this whole campaign of decriminalizing suicide. So thank you so much. And I encourage you again, fill out that form and join the subcommittee for PR and communications.
Thank you so much, Emily. Coming up next, please join me as we welcome Dr. Denise Lewis, who's a clinical psychologist and associate professor at the St. George's University in Grenada, who will give us insights into the Policy and Advocacy Subcommittee.
Dr. Lewis, you're muted.
Good morning, everyone. Are you hearing me?
Yes, we can.
Yes, good morning. I am delighted to participate and to be a part of this coalition. And one of the things that impact me more than anything else is the value of human life. And to be able to participate in whatever it takes to add that intrinsic value to the people that we touch base with, that we work, and especially right now in the context of this decriminalization of suicide in Grenada. I work as a licensed clinical psychologist on the island and work at the University of St. George's. My main role in the country is as a clinical psychologist at large, training, religious leaders, as well as other young people in our profession. And so the challenge right now to develop what we call an advocacy and also a plan for developing policy writing and consultancy for the decriminalization of suicide. And this responsibility provides a necessary opportunity to really pull together the legal minds and to develop a really good policy writing board. Right now, we are scouting and wooing and encouraging, people from the legal profession to join us. And so we have forms and information out there that you can fill out, and also of folks in the profession to forward their information and their names to us. Because one of the main things right now is that the information around suicide and so on in Grenada and in the islands are not easy to come by, because documentation is a problem. And so even to identify numbers and so on for suicide, most times these cases are not reported, underreported, or reported as accidents, etc. And they do have impact on people's lives. And so one of the best people or partners would be the people in the legal profession, or our law firms, our director and the head of the Grenada Legal Association. We have reached out to him and other folks, even people with lived experience from the legal profession, to join and to come on board with us to help us develop that policy for leading our action and our activities here in Grenada. So we look forward to that kind of support that provides really a wide range of expertise, whether from the police, from the legal professions, from the religious communities to join us as we tease out what exactly is happening in our country and what obtains, so that we can be guided by laws and regulations that are specific to what happens in Grenada. So right now we are sending out that clarion call because we are so committed to really adding value to the young people and the young lives in Grenada. And we are not just, being, identifying just young people, but even as we notice the age group that is so affected by suicide at a young age, 15 to 25. In Grenada, 60% of the population here is under 25. And that speaks to what we're up against. And so it is really urgent that we have the support of our stakeholders in Grenada to set, guidelines as to how we are going to go about the activities, what changes we want to make to decriminalize suicide in Grenada. What are some of the impact, on our people here in Grenada, the repercussions, to be able to put those things out there so that people can see the importance of coming in and participating with us. Because so many times people do not seek help because of, the fear of being ostracized, particularly in a country where we are particularly religious, and there is a lot of shame and schisms around that. If there is a death by suicide, people are even impacted financially, economically, even in terms of a family will and what is bequeathed to people, and that is also impacted when we have that experience of death by suicide. Even the ability to mourn and to respect the passing of our loved ones. What happens in a ceremony in the community when somebody is passed by suicide. And these are challenges that are very difficult. And so even for engaging our medical, legal society and, civil society around these issues, so that we are able to identify these things and to inform why we're going to do what we need to do. Why do we want to decriminalize suicide in our country? Because we want to promote that sense of wholeness and well-being and respect for our people, and to provide what we call that sense of value to their lives, that even death by suicide is required that these people experience and receive the support and the help that they need, and that we have the legal guidelines and clarity to show us what we need to do. So right now we are still in the research mode. We are still looking at who's out there that might be willing to put hands on deck and really help us to begin to shape policies, begin to really look at what's happening here in Grenada on our soil and what we need to do to impact based on good data and information, and not just on anecdotal stuff, so that we can create policies that are impacting and will make a long-lasting difference in Grenada. So we're knocking on your doors. You'll be hearing from us as we approach our civil society, particularly people in the legal profession, to come alongside us and help us to develop our policies and inform our activities. Thank you.
Thank you very much, Dr. Dr. Lewis. And I just want to reiterate, and really invite you to join the Policy and Advocacy Subcommittee that you would have just heard about. And not only persons at the local level, but we also want to invite those at the regional level to also join and lend your voice to that subcommittee. Finally, in the coalition structure is the Fundraising and Grants Committee. And please join me in welcoming Alexis Morris from Mindwise TT.
Morning, everyone. Right. Pleasant welcome, everyone. My name's Alexis Morris, and I'll be speaking about fundraising. Before that, though, I'd like to touch on why I joined the Caribbean Regional Coalition for the Decriminalization of Suicide. So, I'm a member of Mindwise, a mental health and suicide prevention advocacy group. And I joined this organization, Mindwise, because I've always been passionate about spreading mental health awareness for a long time, since I was like a teenager. And in addition to my own personal experiences with bad mental health and suicide ideation, I've seen the lack of awareness that many Caribbean people have about mental health due to how taboo the topic is. And this has led many persons to be in the dark with regards to when to ask for help or how to seek mental health services in a time of crisis. As such, by joining this coalition, I'm actively helping with the process of assisting in the realization that a lot of the present policy that we have in place has actively, well, in some cases, actively worked against attempts by governments to elevate accessible mental health services. From joining this coalition, one may gain knowledge and skills in order to educate others, be it their own advocacy groups or their peers or colleagues, about the decriminalization process, as well as how the decriminalization of suicide may actually assist in making persons more open to seeking help. This coalition aims to aid partners in the decriminalization of suicide process, and this is done through assisting national partners in advocacy campaigns, as well as aiding in generating media coverage and the provision of opportunities to engage policymakers on this issue, as well as aiding partners in connecting with others who have successfully decriminalized suicide within their territories. But of course, these actions are not possible without engaging in fundraising activities. So fundraising is the process of collecting or producing money for a particular cause, such as charities or non-government organizations. So for instance, some organizations may engage in fundraising through receiving donations through membership fees or the general public. And contrary to this, some organizations actively fundraise through donor roundtables, events, and applying for open funding calls. As a coalition, we have the ability to approach private donors and funders within our network, as well as work on identifying and applying for funding opportunities. This will involve budgeting, preparing an application as per the requirements of the funder, and by preparing an application, But by identifying and marketing towards a target audience, the organization may maximize fundraising activities as it allows all persons to be more knowledgeable about what the organization does, why these fundraising activities are being held, and their cause, which may increase interest and in turn funding. And it's important to note that fundraising is not a specialized activity. You don't need a degree or any kind of specific knowledge in order to fundraising. Everybody has probably been a fundraiser in their life in one way or another. And everyone here probably has had an idea as to an activity which can assist in fundraising. Maybe some of us have been involved in the fundraising process. As such, fundraising is a way in which our personal creativity can be used in a way to appeal to the general public in order to facilitate the goals of our organizations. So thank you for listening, everybody.
Thank you very much, Alexis, and thank you to all of our presenters who would have gone before. So as we conclude this segment, we've heard from our dedicated coalition members about the critical work being done to decriminalize suicide and enhance mental health support across the region. The insights and plans shared today highlight the immense effort required to make meaningful change. But this is not the journey that we can undertake alone. The success of our initiative depends on the active involvement of each and every one of you. So we need all hands on deck. our colleagues at the regional level, advocates, technocrats, community leaders, and most importantly, the voices of our youth. The young people in our community are not only the most affected by these issues, but also hold the key to innovative solutions and fresh perspectives. So your energy, ideas, and passion are all invaluable to this movement. So we invite you to join our coalition subcommittees, where you can contribute your skills and expertise to areas such as public relations and communications, policy and advocacy, and fundraising and grants. So whether you can offer a few hours a week or lead a new initiative, there is a place for you to join our movement. And you can either scan the QR code on this slide, or you can click the link that has been circulated in the chat. For those who want to stay connected and informed, you can reach out to us via email at csdcsecretariat@gmail.com. And that email address I also saw earlier in the chat. Or you can look out for invitations to attend our regular meetings. And these meetings are a space for collaboration, idea sharing, and planning, and we welcome your participation. By joining us, you can make a direct impact in pushing forward the vital work needed in our countries. Now, in this room, we have the potential to create a significant shift in how we address mental health and support those in crisis. Each person's contribution, no matter how small it may seem, adds to the collective power of our movement. Together, we can ensure that no one feels alone or unsupported in their darkest moments. So, let's unite our efforts, leverage our strengths, and build a compassionate and responsive community. Whether through joining a subcommittee, spreading awareness, or offering support, there is a role for everyone in this critical work. We encourage you to take that step today. Join us, support us, and together, let's make a difference. Thank you for your commitment and passion, and we look forward to working with each of you as we move forward in this important journey.
Thank you so much, Chelsea, for leading that segment, and of course to all of our subcommittee and coalition members for presenting. Definitely want to echo that call that there's so much work to be done, and everyone here has something that they can bring to that effort, and we're really looking forward to connecting with you. If you have any questions at all, please feel free to stay behind after, or to reach out to us at csdcsecretariat@gmail.com. We'll be very happy to assist in responding to those questions. Well, all that's left to do for today is to offer you an insight into our next steps and to also move the vote of thanks. So what's next on our agenda? Of course, you've heard a lot about forming those national advocacy strategies. So yes, we have this great regional effort, this regional advocacy strategy in place. How do we funnel that down to make sure that in Grenada, the activities are targeted, and they're also targeted in the Bahamas, in St. Lucia, and in Trinidad and Tobago? Of course, the coalition will be guiding and supporting this effort. That is to say that even if you are as far perhaps north as the UK and you're interested in joining, we'd be happy to have you, because there's an effort that can reach across the region. So you do not need to be a resident, for instance, of Grenada to contribute to the Grenada context. Likewise, you do not need to be a resident of the Caribbean to be joining this effort. There's no stipulation on that front. And of course, we are hoping to align all of our efforts with global actions, specifically HLM 2025, and hope that we will be successful in implementing these efforts by then. And so I just want to, at this time, move the vote of thanks. Of course, I wish to thank our key partners, namely Mindwise TT, Caracope Wellness Alliance, Let's Unpack It Inc., VSG Psychological Services, the St. Lucia Crisis Center Corporation, of course, MNC Psychological Testing and Counseling Center. We also want to give express thanks to our international partners, the United for Global Mental Health team, the Global Mental Health Action Network, of course, the International Association for Suicide Prevention, as well as Lifeline International. And of course, we're so grateful for the continued support of our multilateral partners, UNICEF, ECA, UNDP, and PAHO. Of course, I also wish to extend special thanks to everyone who spoke in this webinar and who attended our workshop and came back to contribute to this kickoff meeting. Dr. Margaret Nakicha Tour, Bertrand Moses from UNICEF ECHA, Professor Taiwo Sheikh, Gamini Amanawira, and Maria O'Brien, of course, from Mindwise TT. I wish to thank my hardworking co-chair, Miss Desiree Nicholas, who literally was working day and night to pull this launch webinar together. I'm really looking forward to partnering with you, Desiree, over the next 2 months as we chair this coalition. Of course, I wish to thank Chelsea for moving that segment on our subcommittees, and all of our coalition members, Leon, Emily, Dr. Denise, and Alexis, for helping to shape and to really showcase the work that we're aiming to do as a coalition, and for giving that clarion call, of course, to advocacy. And of course, I must thank expressly Asta and Ali from UGMH, who from the get-go have been helping us to coordinate this effort. We know that you enjoy being behind the scenes, but I want to, as we say, big you up in front of this audience today, because your work and your partnership with us has been pivotal in getting us to this point, and we're really looking forward to working with you moving forward. Of course, I wish to thank our attendees here today, and I am going to change that to say our prospective coalition members. We invite all of you to again take those 3 actions. Number 1, scan that QR code and join one of our subcommittees. If there's a way that you're looking to partner with us, or if there are any questions that you have, please reach out to us by email. The email is csdcsecretariat@gmail.com. And finally, we do invite you, of course, to take any other form of action, be it engaging with us, looking out for the invitations via Gmail and so on. We just really want to work with you to advance this work that we believe will build hope and save lives. And so all that's left for me to do then is to wish you a wonderful start to this week. I thank you so much for joining us, and we look forward to engaging with you very soon. Take care, everyone.